These managed care discount programs are the biggest ripoff for individuals who have hearing aid insurance coverage. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 264, and today I want to talk to you once again about why third-party administrators are really bad for people who have hearing loss that happen to have insurance coverage for hearing aids. But before I get into this video, do me a huge favor, click the like button, really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. Now, I'm struggling to figure out a way to articulate what I'm about to say in this video in a clear and concise manner because hearing aid insurance coverage is complex. Some people have traditional hearing aid coverage where they have a deductible they have to meet, and then after they meet that deductible, they get a certain level of coverage with an in-network provider where they have to, pay a certain percentage of whatever the treatment is, and then the insurance picks up the other percentage. If you go to an out-of-network provider, meaning that the provider is not contracted directly with the insurance company, the insurance will still cover some of your treatment for you, maybe not as at an advantageous level of a rate as you have with an in-network provider, but you can still use your insurance coverage to procure hearing treatment. Well, over the course of the past, 10 to 15 years at this point, what insurance companies have been doing is they've been contracting with third-party administrators, which we will call TPAs. So they contract with these TPAs and they say, hey, listen, we want you to administer all of the hearing aid benefits that we have inside of our insurance plan. We'll pay you a certain amount of money and then you handle it on your end. And this way, the insurance company ultimately saves money because they're paying a middleman to basically drive down the cost of coverage to them when it comes to hearing aids. And then these administrators go out and they find a bunch of private practice owners and say, hey, listen, we can feed you a ton of patients from this insurance plan for them to come in and get hearing aids. You just have to be willing to accept a really low reimbursement rate when you fit those patients with hearing aids, and you have to provide them a certain type of services, and ultimately, it's a win-win for everybody because you get a lot of patients, you still get a payment for the services that you provide, and the insurance company saves a bunch of money. So that's kind of how it was portrayed. Now, these third-party administrators have been growing like absolutely crazy. It's insane to see how many people actually have quote-unquote hearing aid coverage, which is really just a discount plan through these TPAs, because ultimately you still have a lot of out-of-pocket costs in most cases when you're using a TPA. So if you have Medicare Advantage, for instance, almost every single Medicare Advantage plan has some kind of a hearing aid discount built into it. And as long as you go to one of their providers who accepts that third party, you can go there and you can pay, a few $1,000s to actually get a pair of hearing aids and those devices fit on you by a hearing care professional. But at the end of the day, what's been happening is a lot of private practice owners and organizations have been getting out of accepting these third-party benefits because the reimbursement is so low. In fact, when I used to participate in these third parties back in 2017 when I first started my clinic, all the way up to 2020, every single year the reimbursement that I got from the TPA was going down and down and down to the point where I was like, I can't make money on this, and if I can't make money on it inside of the clinic, I can't keep the doors open, and ultimately I'm taking the profit from my private pay patients to subsidize all of the patients who have the managed care benefits, and I'm like, that's just not fair to have one group of people basically paying for the treatment for another group of people, at least not in my clinic. That's not how we like to run things because we ultimately like to provide an extremely high level of care. So that has been a more growing problem, and now there's a debate inside of the hearing aid, the hearing care professional world, meaning audiologists, hearing instrument specialists, as to whether or not it is a good idea or even possible to still offer or to still accept these third-party administrator terms and stay in network with these insurance companies. And so there was a panel discussion that was formed at AAA, and Noel Crosby, who happens to be a Hearing Up member, asked me if I wanted to be on the panel. And I have not been accepting third parties since 2021, like very beginning of 2021, we cut off ties with every TPA that we were in network with. So we've just been going private pay only since that point. We don't accept any insurance except for Medicare that we have to accept, and that's really only for hearing testing, okay? So it was a group of 3 of us that are private practice owners who no longer accept TPAs. We all used to, but we all ended up getting out of all of our contracts with TPAs. And then there was a group of 3 audiologists who were still in network with third-party administrators. And they had their own reasons for being in network. But, you know, it was kind of like it wasn't like a debate going back and forth. It was just all of us sharing, like, how do we continue to run successful clinics, whether we're in network with TPAs or whether we're out of network with TPAs. Now, I was and still am good friends with several of the audiologists that were on the panel, especially the group that accepted TPAs. And there's several reasons why I personally don't believe that we can be accepting, or should be rather, accepting TPAs. Now, it's not from a profitability standpoint, because clearly the 3 who are still in network with TPAs are finding ways to still remain profitable when serving a TPA patient. I'll explain how they do that here, but I just didn't feel comfortable having my services devalued by the TPAs, okay? And on top of that, I don't like being restricted on what devices I can dispense to a patient who has a particular type of coverage. And I don't like the fact that I would have to cut corners on their treatment just in order to break even or stay profitable by offering services to these individuals who come in wanting to use their TPA benefits. Ultimately, this reduction in TPA reimbursement, you know, and it's even gone even lower since 2021, since we got out. It's 2025 right now, and every single year, the amount of money that TPAs pay out to the hearing care professional has been going down. And I don't know if you guys have been paying attention to inflation at all lately, but inflation from back in 2017 till now is pretty significant. And so not only is the total dollar amount that's being reimbursed to providers going lower, but inflation is devaluing that money even more. The one thing that was shocking to me is that by the time we got out of accepting TPAs inside of Applied Hearing Solutions, we had to see 4 patients with TPA coverage for every 1 patient that had private pay. And what that basically means is that we had to spend 4 times the amount of time with patients in order to generate the same amount of revenue that we would generate from 1 private pay patient. Now, you're probably thinking, well, how is it possible for any clinic to accept it? Well, for the individuals on the panel who still accepted TPAs, here's what they did. First of all, they only accepted certain TPAs, the ones that they had at least a decent reimbursement to them, you know, of a couple hundred to maybe, I can't even say $1,000. I mean, I think the average in the industry is like $800 for a pair of hearing aids that are being dispensed, and you have to do the testing and fitting and all that stuff with that amount of money, and that's very, very tight from a margin perspective. So, but the way that they would do it is if certain services were not covered under their contract with the third party, they would charge additional to have those services done. So, for instance, real ear verification. Real ear verification is the gold standard when it comes to programming a pair of hearing aids, and a lot of these third parties do not mandate that a hearing care professional does real ear measurement. They just say, yeah, just fit the hearing aids on the patient, let them walk, right? Well, you know, if you're going to be following best practices, you can't really do that. So what they do is they're like, well, we can do all of these best practices on you with these hearing aids, but you're going to have to pay extra for them. So if you want those, we'll provide them to you. If you don't want them, then we just won't do the thing that is required to optimize the performance of your hearing aids. So essentially, they're okay with letting you walk out of the clinic without having hearing aids set up properly for you, which I just personally don't feel comfortable with. The other side of it is that if you come in and you have one of these TPA discount programs, they'll essentially match the discount with the hearing aids that they sell privately and just take you off of the discount program for the insurance, and they'll put you on their own discount program. So they basically circumvent the insurance, they make a little bit more money that way, and they can find a way to keep accepting these TPAs. Now, whether that's ethical or not, who knows? I mean, that's not for me to decide if that's ethical or against a contract. I don't have their contract, so I don't know. But that's essentially what they ultimately do. Now, the thing is that all of the 3 pro TPA, and I don't even want to say pro TPA because none of them really like TPA. They know that it's ultimately bad for the industry, that it's not great for their clinic. They would all prefer to provide a high level of care to every single one of their patients by following comprehensive best practices, which means that everyone's paying privately to get those. But a lot of them feel like they're inclined to want to serve their community if they live in a lower cost of living area, so on and so forth. But, my argument for this is that I just truly feel that if people want to find discount hearing aid care, you can pretty much find that anywhere. I mean, there's always some place that's willing to sell you hearing aids for dirt cheap, and, whether or not you hear great with them, I mean, that's kind of what you're giving up, is that you're giving up the absolute best hearing that you can possibly get if you're trying to get a deal on it. Now, I also sympathize with people who want to use their insurance coverage because they're paying out of pocket for that insurance coverage a lot of the times. Even if you're Medicare Advantage, like you spent your whole life working to get this, benefit by the time you retire, and then to the thought of just like not using it for a lot of people is just like, I can't fathom not using my insurance benefit. And even though it's not really an insurance benefit, it's more of a discount, like I said. But, I sympathize with that. But for me, at least in the position that I'm in right now, just being an influencer online, is that I don't feel comfortable in offering substandard care to some patients, okay? Like if they can't afford to pay extra for best practices, like why would I treat them without following comprehensive best practices? And this was the problem. This is why I couldn't make money on it, because I refused to not follow best practices with any patient who came into my clinic, even when I accepted TPA, even if I lost money on every single patient that I saw coming into the clinic. So I'm not going to basically offer that inside of the clinic. I'm not going to offer an option to where you don't get the highest level of care possible, so I might as well not even offer it. But in the greater area of Phoenix, there's plenty of places that you can get discount care from. There's very few places you can get really high level care from. And we want to be one of the places that you can get really high level care from. On top of that, if you look at the numbers in the industry, someone who uses their TPA benefits for hearing aids, they see their provider 40% less than someone who pays privately for their hearing treatment. So basically what's happening is that time is being restricted, corners are being cut for people who are using their TPA benefits. And globally, I shouldn't say globally, across the United States, that is leading to an extremely low level of care for a lot of people using these benefits. And I just personally can't support that program that is allowing this to happen. It's all in the name of cutting costs at the expense of the person who's actually trying to hear better. It was actually a very fruitful discussion that we had at the conference. Nobody got mad at each other. No one was criticizing anyone for accepting or not accepting TPAs. It was just a very nice open discussion about pros and cons, both ways, about being able to accept them and not being able to accept them ultimately. Now, where do I think it's going in the future? Well, I think what's going to happen is that these insurance companies, or rather these TPAs, these third-party administrators, they're going to continue to reduce reimbursement to the providers. What's going to happen is you're going to start seeing a lot of attrition. All of the best providers are going to leave these networks first. And all the other providers are going to still try to make ends meet by accepting these TPA benefits and just providing less and less and less care to their patients under this coverage. And it's unfortunate, but eventually it's going to get to a breaking point where you're just not going to be able to have that many places you can go to use your hearing aid discount through these TPAs. So if you have Medicare Advantage, you're at some point you're going to be screwed where you're like, I have to go where? I have to travel how far to get to a person who accepts my insurance, and then when I get there, they're basically just handing me the box with my hearing aids and I'm responsible for like setting everything up myself. We are getting to that point, okay? And so eventually there's going to be nobody good left where you can get hearing aids from that stays in network with these TPAs. So ultimately, at the end of the day, you just got to roll the dice. Are you willing to go out of pocket to get really high level care, or do you want to make sure that you're going to someone who's in network with your TPA and get whatever level of care they're willing to offer?